Okay, path video number 2. We're starting with necrosis and a very sharp pencil. When the damage is too much, make sure the camera's in the right place so we don't have a stand yet. Too much for the cell to handle, it leads to cell death or necrosis. There are several types of necrosis. Coagulative necrosis occurs in myocardial infarctions, also known as MIs. It's due to protein denaturation. Liquefactive necrosis is seen in brain infarctions and in any abscess. Caseous necrosis is seen in tuberculosis. Enzymatic necrosis is seen in acute pancreatitis. Interesting. Gangrenous necrosis is seen in frostbite, which is known as dry gangrene, and diabetes, which is wet gangrene. Fatty necrosis is seen in liver damage and injury to fatty tissues. Fibrinoid necrosis is seen in blood vessels and in some autoimmune diseases. In addition, there are 2 types of degeneration. One is called Zanker's degeneration. It's the waxy hyaline seen in skeletal muscle damage. Wallerian degeneration, hopefully I'm saying that right, is the dying back or antegrade of the nerve axons after injury to the nerves. Okay, apoptosis. There's a special type of cell death which is programmed. That's apoptosis. It's regulated by nitric oxide and requires ATP. In apoptosis, individual cells are affected. There's no inflammatory response in the surrounding tissue. The organelles and plasma membrane of the affected cells are intact, and the surrounding tissue is unaffected. Nuclear changes in cell death. When a cell is irreversibly injured, the nucleus undergoes specific changes. Pycnosis is irreversible nuclear chromatin condensation or clumping, which is due to pH. Karyarexis is irreversible chromatin fragmentation from high calcium influx. Karyolysis is enzymatic breakdown of DNA, causes a complete disappearance of the nuclear material. Healing and repair. Healing is a process of restoration to normal structure and function. Healing and repair are linked with inflammation. If there is reduced inflammation, healing will be impaired. Phases in healing. Angiogenesis is when there is new blood vessel growth. Fibroblastic activity is when parallel layers of collagen fibers are laid down. Deposition of extracellular matrix supports new blood vessels and fibrous tissue. Remodeling. Removal of excess tissue. Primary versus secondary intention healing. Wow, I don't remember hearing about this before, so glad it's in here. Primary versus secondary intention healing. Let's look through this chart. Size of defect is small in primary, and sutures are used in primary. There is some granulation tissue in primary. The rate of healing is rapid in primary. The size of the scar is small in primary, and the complications are none in primary. Secondary. The size of the defect is large. Sutures are not used in secondary. There is more granulation of tissue. The rate of healing is slow in secondary intention healing. The size of the scar is large. The complications are keloid, abscesses, or sinus. All right. That's pretty clarifying. Primary versus secondary intention healing. Healing of bone fractures. Reactive phase. Hematoma formation replaced by granulation tissue. Reparative phase 1. Deposition of cartilaginous tissue by chondroblasts forming a cartilaginous callus. Preparative phase, phase 2. Replaced, that's a typo. The cartilage is replaced by bone and fist woven bone, then first woven bone, then trabecular bone. Woven bone 1, trabecular bone 2. Okay. Modeling phase. Removal of excess bone tissue by osteoclasts. Turn the page. We're on to a new section. I think we'll stop that video there so we don't mix up sections.